Watch these finger signs if you have diabetes. Talking about trigger finger, a nasty thing that can happen to any diabetic. Pain or discomfort at the tips of your fingers or thumb that won't go away. When you move your finger, you hear a clicking sound. A benign growth at the tip of your finger or thumb, or worst, your finger is not moving anymore and stay bent. Have you downloaded the SugarMD app yet? If not, you are missing out on some great resources for managing your diabetes. Our team of experts offer free coaching via app texting so you can get answers to all of your diet and diabetes related questions. Plus, using the app daily will help you stay on track and help make healthy choices. So, download the app today. Start living your best life. Remember to subscribe to our newsletter for weekly educational emails as well. Any diabetic is at risk for trigger finger. You may wake up one morning to find that your finger is bent in a strange way. It is possible that you will need to physically undo the bending. If it has not happened already, it will probably happen in the near future. Diabetes-related Murphy's Law. Join me in fighting the odds with you. You're not in a comic book, so don't let your fingers become a superhero stiff. Medical professionals refer to trigger finger as stenosing tenosynovitis. However, to be completely forthright with you, I have never once heard anyone, not even my coworkers, use this medical term. The medical community is not immune to the term trigger finger. Terribly humbling, right? Well, let's examine this common yet challenging condition and the steps you can take if you find yourself experiencing symptoms of diabetes in your own fingers. Let's explain the term trigger finger. Inflammation of the tendons, the tendons that allow you to bend and flex your fingers and thumb, causes trigger finger inflammation in them, right? It can be painful, hinder your ability to move, straighten, and use your fingers for even the most basic daily tasks. People with and without diabetes share a high prevalence of this condition. Now, when you clench your fist, it is the tendons that act like ropes to bring your fingers together. At the base of each finger, those tendons enter a narrow tunnel that acts much like a pulley system. If not for this tunnel-like structure, the tendons on your fingers would actually pull away and bow from your fingers rather than tighten against them. The tendon is rubbing, and as a result, it is bending into the tunnel. Like a callus that has been growing for years, the tunnel gradually contracts and thickens as time passes. We call that getting old too, right? Well, however, the severity of this condition can vary greatly from one person to the next. As it progresses, you may experience nothing more than pain at the base of your finger, some stiffness, an impaired ability to fully strengthen a finger, or a diminished capacity to make a tight fist. When it gets caught or stuck, the situation is most dire. You can't straighten that finger or open your hand any further by hand at all. That's a problem. This pattern of gradual escalation does not hold true for all cases, though. Some people get up one morning and find that their finger is all locked. Who is most likely to get trigger finger? Trigger finger is surprisingly common in people with type 1 and type 2 diabetes, despite being a condition that is rarely brought up in daily conversations and regular visits. The current reviews in Musculoskeletal Medicine journal in 2008 actually revealed that diabetics have a much higher risk. The risk is proportional to the duration of diabetes, regardless of the blood sugar levels. So trigger finger occurs 6 times more often in women than in men, and trigger finger typically appears between the ages of 40 and 50, but it can happen at any time. Trigger finger is more common in those with certain medical conditions like carpal tunnel syndrome, the core veins tenosynovitis, hypothyroidism, rheumatoid arthritis, the kidney disease, amyloidosis, and so forth. The most common sequence of affected fingers are pinky finger, ring finger, the thumb, middle finger that I'm not going to show, and pointer finger, the index finger. As a result, yes, the risk of developing a trigger finger is really, really common in diabetes. Is there a link between high blood sugar and the danger for this? To put it briefly, I would say no. As I previously said, studies show that the length of time you have diabetes is more important risk factor or an indicator of developing trigger finger than your blood sugar levels. That's a bummer, right? However, studies have not yet established a really causal link between diabetes and this condition, so high blood sugar levels have not been definitively linked as a cause. But let's not forget how trigger finger works. Inflammation and injury of the flexor tendon sheath complex result from microtrauma, which can be caused by either repetitive use or compression forces. Diseases like diabetes are known to cause inflammation. This illness is not merely a sugar problem, right? Therefore, reducing insulin resistance will also decrease inflammation. Maintaining good control of blood sugar is still essential for preventing peripheral neuropathy in your fingers if you don't want to have more problems. Additionally, antioxidants will help lower the risk, like dihydro-berberine, benfotiamine, alpha-lipoic acid, B-complex vitamins are still your best bet. SugarMD, super berberine, neuropathy support, have them all. Well, this is not an advertisement, so you're under no obligation to purchase from us, but please do your research and only purchase from a reputable source. And as many businesses, even the large ones, are able to avoid FDA oversight sometimes, which as a physician I find it's shameful. Keep in mind that even when blood sugar levels are normal, they can have a major effect on the health and function of your fingers. So it is still essential to keep the inflammation down even if your glucose is under control. The stiffness in your fingers is nothing to be ignored. The fact that the morning stiffness in your fingers or thumb disappears as the day progresses is not a reason to put off seeing a hand specialist for what could be a serious issue. Now, diabetics, they have a problem. They frequently attribute everything or their stiffness or whatever to the disease itself. They chalk it up to the effects of diabetes instead of saying, oh, there may be something else wrong. In order to avoid the need for surgery, it is essential to recognize the early warning signs of trigger finger in one or more fingers. So what are the examples of early warning signs? Well, pain or discomfort at the tips of your fingers or thumb that won't go away. When you move your finger, you may hear a clicking sound. A benign growth at the tip of your finger or thumb, toughness or roughness of any kind can be a presenting symptom. A lot of people take a long time before they even ask a question, but the early treatment is always preferable. If you intend to have surgery to correct the issue, it is still important to make an effort every day to strengthen the affected fingers. The stretching is very important. If you don't make an effort to straighten that finger on a regular basis, you're not moving it to its full extent, which causes it to stiffen more and lose flexibility. If you want to increase the chances of success for surgery or other treatment options, forcing your affected finger to move every day is like walking every day to keep your knees lubricated. Let's talk about how to treat your trigger finger. Most orthopedic surgeons will advise patients to seek treatment for trigger finger as soon as possible, as they have seen way too many people suffer from the condition for years and years or even decades before they seek for help, and it's too late most of the time. Common treatments for trigger finger include regular physical therapy sessions, again, that consists of stretching and exercise, and treatment typically consists of resting the finger in between the exercises and using a splint, over-the-counter painkillers, and sometimes injections with steroids, although that's not desirable because it can really temporarily increase your blood sugar levels. So you and your diabetes doctor may need to talk about this and maybe make a plan about what to do with your medications and so forth if you are planning to have a steroid injection. Now, operative release of the finger or thumb is another option. Injections of steroids and splints are still first line, but surgery has pretty much 99% success rate, but with a long road of physical therapy ahead of it afterward. Now, when diabetes is present, the success rate of injection decreases, but still the surgeons prefer to do injections despite diabetes. Remember that your diabetes team may advise you to make changes to your background insulin doses if you receive steroid injections, so be proactive about that. Again, steroids especially raise your blood sugar levels after eating. So if you're taking mealtime insulin injections, you will have to almost sometimes change from 20 to 100% increase in your medications. And most of the time, the insulin is the case. So monitor your blood sugar levels closely and stay in close contact with your healthcare team if you are getting any type of steroid injection to any part of your body. With that, we came to the end of this video. Well, we appreciate you checking out this video. I will be eternally grateful if you could share this video with your friends and give a thumbs up if you don't have a trigger finger, right? So show your support for the channel. Please let me know in the comments if the video helped you in any way today. I welcome viewer feedback and I'm happy to address any concerns you may have. A simple thank you in the discussion section, in the comment section is greatly appreciated. And I appreciate you taking time to watch, and I wish you best of luck and avoid trigger finger. See you later. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.